In my experience, I've had many patients try diets and feel frustrated because the weight comes back. With the endoscopic sleeve gastroplasty, we are providing a tool to help make sure that all your hard work towards creating a healthier lifestyle is going to pay off in the long run.
Endoscopic sleeve gastroplasty is a non-surgical, minimally invasive weight loss procedure. It allows us to decrease the size of the stomach by suturing it from the inside endoscopically. It is not a surgery, so there are no incisions and there are no scars. It's an endoscopy, so it's very well tolerated, and it's done as an outpatient procedure. So the patient undergoes the procedure, and then we watch them in the recovery area for an hour or two, and then they go home. We use an endoscope, a flexible tube with a camera and a light on its tip, and we introduce it from the mouth and go down to the stomach. We start initially by marking the areas that we want to suture. So we mark the anterior wall and then the posterior wall of the stomach. Then we use a suturing device that is loaded on the tip of the scope to place full thickness sutures in the wall of the stomach. We start by suturing the anterior wall, the greater curvature, and the posterior wall of the stomach, and we repeat this suturing in a triangular pattern in a way that allows us to pull these sutures together, and when we do that, the stomach gets invaginated on itself, and when we repeat these sutures and pull them together, we form the sleeve. Eventually, when we're done suturing the stomach will decrease around 70 to 80% in size, and it becomes shorter. How does it work? ESG works in two different ways. One, by decreasing the size of the stomach can only accommodate a small amount of food. And two, by decreasing the rate at which the stomach empties the food into the small bowel. So what happens is that we can eat a smaller amount of food, but also the food stays in the stomach longer. So we don't feel the hunger quickly. So the patient can stay on a low-calorie diet and eat less without feeling hungry all the time. ESG is very effective. We have data that show that 2 years after the procedure, most patients experienced around 18 to 20% total body weight loss. More importantly, we know that the weight loss is maintained long term. So we have data that show that at 5 years, on average, most people maintain 15% total body weight loss.
It's important to think of the procedure as a first step. After that, we will continue to work closely together to help you adopt a healthier lifestyle and achieve your weight loss goals.
Is it reversible? ESG is not reversible, but that's exactly what we want. What happens is that we put the sutures in the stomach, and then when we pull the sutures together, the stomach eventually heals on itself, and we can't even see the sutures anymore. That's a very good thing, because that ensures that the stomach stays in that shape, in that form, long term, and the results are maintained long term. Patients who undergo ESG experience benefits beyond weight loss, mainly improvements in the control of the blood pressure, the blood sugar, and the improvement in sleep apnea.